Okay, well, welcome to this afternoon session of the Global Media Forum. My name is Kristen Zeyer. I'm a journalist here at Deutsche Welle. And for the next 30 minutes, we're going to spend time discussing the universal topic of health. The title of this session is called Health is More Than Medicine, Moving Towards a Fairer Distribution of Care for All. Now, when we talk about health as a universal topic, we have to discuss the UN Sustainable Development Goals. And in these Sustainable Development Goals, clearly it's stated that it is to ensure healthy lives and promote well-being for all at all ages. Sounds like a matter of course, something that we can take for granted here in Europe, in Germany, in the West. But for some 400 million people around the world, they have no access to health. So we have a goal that is a massive challenge for us to reach, and we have the reality on the ground. And today we want to talk with my two guests here about the responsibility that science plays, responsibility that the pharmaceutical industry plays, and the responsibility that we have as policymakers to ensure that we reach this goal. So without going into the topic too much more, I'd like to introduce my guests. Today I have here with me on my first left, Professor Detlef Ganten from the World Health Summit. He's the founder and president of this international forum. For about 10 years now, they gather people from all around the health sector, but not only the health sector, also educators, policymakers, scientists, to discuss the issue of what global health means. Professor Ganten, I'm going to use the first names here, this is in English, Detlef, thank you for coming. And my other guest is Peter Alberts, who is the chairman of Pfizer Germany. It's an American pharmaceutical company. He's has been instrumental in doing quite a few interesting things. One of them is the healthcare hub in Berlin, which is an interdisciplinary approach to bringing health and technology together. So maybe we can get some new inspiration about what could be the state of health in the future. But before I go into that, I want to ask you something, Peter, that you mentioned, and that is about the role of Germany. You've said that you think that Germany can take on and should take on a bigger role, more responsibility. Can you elaborate that and tell us what you could envision that meaning?
Well, I mean, from my perspective, Germany has started to take increasing responsibility when it comes to global health issues and challenges. Looking back at the G7 summit, G20 summit, and all the work around that, I think Germany, Chancellor Merkel, and others
the previous G7 summit.
The previous G7 and in that role, I think Germany has created quite some presence internationally on those global challenges and questions, be it neglected tropical diseases or antimicrobial resistance and others. And I think that has created significant awareness and tractions, and I think we can further build on that. Germany has, I believe, the capability, the connectiveness, and I think also acceptance in the international community to play a significant role there, bring people together and advance in what has been started. So, good start, but I think we can aim and shoot for more.
Okay, let me ask you, how realistic is that? How much can Germany, one country, or even a continent like Europe, actually achieve when health is on so many levels shaped on the national level? What role can a country like Germany play?
Germany alone can do very little. Mm-hmm. It's a small country, we are rich, but I mean our outreach is limited. All we can do is stimulate the international community to go along with this humanitarian goal. And let me take up what Peter said. I mean, I'm old enough and I see some very young people here, which is great. My father told me about World War I. Mm-hmm. I personally experienced the consequences of World War II. Germany was destroyed twice within 2 generations. And we've seen all the misery. And we were part of, getting the world wars staged.
Part of it? Yeah, okay, that's an understatement.
Germany played not a very peaceful role during this time. And we have been helped by the international community to become a stable democracy and a rich country again. And I think we have to give back. And this is my personal motivation to really go ahead. And I'm extremely happy that actually it was Chancellor Merkel who really took it up on the international scene, that when she organized Heiligendamm, I'm a member of the National Academy of Sciences in Germany, and there's an inter-academy partnership of the National Academies of Sciences, and they counseled the G8 heads of state that when they come to Germany, we have to include science because the future is dominated more and more by science. And if it is science, it has to be humanitarian science. And the best part of humanitarian science is health, health for all. So this is my motivation, and I think there is a overarching consensus in Germany that this is what we have to do. And you were asking what can we do, how we can do it. Of course, it's not German science. Science is completely international. There are no borders. There's never been any borders between sciences. No dictatorship can prevent ideas to cross borders. So this is an international movement. You mentioned the SDGs. I think it's a great sign that the United Nations took it up, and we have to do everything to support that.
Okay, then let me ask you about, you talk about scientists, no borders. Scientists work together. What is the role of scientists? You yourself have said that scientists need to be more responsible, more involved in putting the human focus back in medicine, for instance. What do you mean by that?
Well, see the young people here. What is science? Yeah. Okay, in Germany, you always ask the fundamental question, seriously. Okay, so science, of course, you do in the laboratory. You do medical science, and you do experiments, and then you have to translate that into clinical science, what can be applied from the laboratory to human, and then how to improve population health, and how to translate that into better health for all. But science is not just medicine. Yeah. There are political scientists, you know, and there are sociologists, and everybody who is a critical thinker, by my definition, is a scientist. You don't have to be a professor to be a scientist, okay? So science has to work together. And what can we do? Science, like in politics, we tend to be fragmented. There are medical scientists, there are biologists, there are physicists, and there are political scientists, and so on. And they work in their sector, they're in their silo. Get them together is easily said, but it's not easily done, because it takes time, it takes understanding, it's a different vocabulary, and you have to have a common goal. And what is the common goal? Not so easy to define for a world community. And the SDGs, I think, are a wonderful example. And you mentioned SDG 3, health and well-being for all. But if you look at all the other SDGs, partnership is number 17, no corruption and good governance is number 16, and life under the water is number 1. And they're all fixed together. I mean, they're all applying to well-being of the people. So all the SDGs, the entrance into the SDGs is well-being of the people. What are the SDGs for? Because the people want to live better. You want to get them out of misery. So that is what we need. Overcome the silos, overcome fragmentation, and take a holistic picture. Okay. That's what science can contribute.
And then let me ask you, Peter, because overcoming the silos with science, I can understand. One of the other silos we have is the private industry, the pharmaceutical industry. I think it's probably many people would say when it comes to a pharmaceutical company, they're a bit skeptical about what Pfizer or others, what they stand to gain. So maybe let's put it in this way. What can a pharmaceutical company like yours gain, or why do they concern themselves with this topic?
I think it's always good before you think about the question, what can you do? What are you here? You know, what's your purpose? And I think that's to me is the most important point. Why are we here? The key thing is we are all about health. I mean, that's the starting point. So our purpose is that we work for all the patients in need and advance their health. I think that's the key aspect. That is global. That's one aspect. Detlef just touched on it. And the other aspect is we can't do it ourselves alone. We can play a part, but it needs working together with everyone else. Once you really take the purpose seriously, it's just natural. You have to work together and integrate all efforts. What do we bring to the table? Now, coming to that next step, the key thing is innovation. Of course, it's hard and tough to develop new medicines and vaccines. We have still lots of devastating diseases, and it takes years. It takes 10 to 12 years. It takes 1 or 2 billion investments on average to advance a medicine, a new one. So innovation is a core piece. But then thinking about our topic of global health, there's, I think, other capabilities we can bring to the table. We have a unique workforce with a variety of skills which we can bring in there, and we have a global presence. So we are present in many countries. We have a global footprint. We are well connected. We have knowledge about healthcare systems, and also can bring those ideas and thoughts in, which have been maybe proven to be successful in one part of the world and bring it to another part.
Do you have an example? Because that sounds all very good, but concrete example of how this has actually been put into action?
We can look at it from different perspectives. So one, I think the first one is partnerships. So really work with global organizations on advancing health. Infectious diseases, take that one, is a crucial burden. So what we do is we partner with Gavi, a global alliance for vaccination and immunization. We address specifically the issue of pneumococcal diseases and help to give access also to a pneumococcal vaccines, which we can provide in that regard. Another topic on that is we have been co-founders of an initiative called the International Trachoma Initiative. Trachoma is the major cause for blindness, and we have founded that together with many other organizations to address that. That works since 1998, and you just think about the numbers we've supplied since then. I think 500 million doses of this antibiotic, which prevents the infection. And about 100 million patients around the world since then have received it. So that's already, I think, a significant contribution. But let me step to another aspect, which is really working also on the question of infrastructure and supply. So beyond infectious diseases, non-communicable diseases play a significant role also in developing countries. And that is, for example, cardiovascular diseases, it's cancer, it's diabetes. And those numbers start to increase significantly also in developing countries. So in sub-Saharan Africa, for example, cancer plays a key role. And here we work with local organizations on education, patient awareness, consulting for building infrastructure, also building up local research. How can that be done? So it's very closely with communities and those organizations like Empath, Pink Ribbon, and others, which we work with in sub-Saharan Africa. Okay,
so I think education is an important aspect, and I'd like to go back a bit later to the knowledge transfer between countries. But Detlef, you wanted to say something?
I would like to add. Yeah. I agree with everything Peter said, and of course, good science has to be translated also to products, and pharmaceutical drugs and everything Peter has mentioned is necessary to promote health. But as I'm critical with my own discipline, science, we have atomic physicists and we have engineers who produce weapons. And without this science, mass destruction and chemical weapons would not be there. Not as bad, but also this private sector is producing certain products which are not healthy. And they will produce it for a market, and whoever wants to buy it can buy it and kill himself and kill others. So just mentioning tobacco, mentioning alcohol and others. So, and this morning actually we have heard about freedom of opinion and the Googles and Facebooks and others. It's a private sector, it's free information, it's wonderful, but there are always good and bad signs on the same coin. So we have to be extremely critical, self-critical, and also with each other, and always have one goal in mind. And this is not natural and not coming by itself. It is for the well-being of the people. And those who don't work for it, they have to come upstage and they have to respond to young people, those who are in need. Why do you do that? So you can earn money with more ethical products than those on the market, and this concerns many parts of the private sector, as it does parts of what is being done in the laboratories and in science.
Well, then let's ask the question about the policymakers. What can they do to hold both the scientists in the laboratories? There's also a freedom of research as well, and the private sector. What can they do to hold them accountable? Do we need extra additional measures to prevent this kind of thing from happening?
Yes, we need democracy. We need transparency. We need corruption-free societies. And we need transparency. Get them upstage and let them respond. And of course, the politicians are extremely important because they set the rules how the world functions. And we have seen examples in the last couple of days how they can, how destructive they can be to kind of violate the rules which we agreed upon, and good behavior in a way, and don't know what's coming out of it. So politicians are the ones we elect to make the rules we live in. And these rules have to be, of course, have to have some international standards. You cannot standardize the whole world. We don't want that.
But are those international standards agreed upon? I mean, this is not a health topic, but let's talk about, real quickly mention here when it comes to ethical standards with big corporations. We have just recently the merger of with Monsanto and Bayer, and as a German company wants to have their ethical standards that we hold apply to that company. Those are different standards, and I'm asking the question now about what can we do to ensure that ethical standards are the ones that are pushed through and not just the bottom line and the money that's made. Is there anything we can do?
I think to me the key point is live by example, right? I think one is, my Detlef has articulated that, one is that we create from a policy maker perspective, we create the environment, rule of law, transparency. When it comes to us and others, we need to live by example. And I think to me the key aspect when it comes to make a difference in global health is we need to commit on one goal. And you mentioned it, we all need to be there to make an impact on global health, on patients, and in specific areas and topics. I think that needs to be articulated. And then everyone needs to be held accountable that he or she contributes. And at the end, it doesn't matter who you are. You are a private company, you're an NGO, you're a policymaker or a scientist. Once you have agreed on that, we need to hold ourselves accountable. I mean, as easy as it sounds, but that's the way. And if not, you said it. Let's articulate that. Let's bring us up on stage, and then things will become visible if we are really serious about it. About the goals and what we have set ourselves up against.
Yeah, Detlef?
Well, I was so happy to come here because I'm convinced neither scientists nor the private sector, and especially not the politicians because they have to get elected, will follow ethical standards easily. There are many temptations to follow egoistic ideas or group ideas or whatever. Journalism, free speech, publication of what's going on, investigative journalism. If something is not transparent, find it out and then make it open to the public. It's so important. And again, diversity is important there. Deutsche Welle, of course, is fantastic. And I hope, at least in this part, in this same part of German history, there is freedom, I think so, but there have been parts in German history where the freedom was not there for the press. And there are countries where there is no freedom for the press. So this is extremely important because the individual can do very little. You have to have spokespeople. And the journalists, the newspapers, television, and so on, they're extremely important to control what's going on in society.
Yeah. And educators, and that's where I'd like to ask about knowledge transfer, because journalists can only do so much. We know that in those regions that don't have the access to health, education and health awareness is an important aspect. So what I want to know is, what can we do to ensure that what we're developing, what we're researching, what the scientists in their laboratories here in Germany are doing, we can make sure that our knowledge is transferred to regions so that they are empowered to be able to develop that medicine that they need or that health care they need.
Well, do as much for education as you can do. There's no more noble goal than education of the young people as early as possible, independently of social status they're born in, and then communicate this knowledge. And meetings like this one, if it concerns health, it's the World Health Summit, if I may say so, which is, as far as I know, the only forum. That's why it's so successful, where all stakeholders, private sector, politicians, there's one politician here who's been there all the time, and the civil society and scientists come together under complete academic freedom of science. And they're being asked, and they can tell whatever they want to in a non-violent way, but then they're asked to be responsible for it. And education, so this is the more general aspect, but also for health. This is about health, okay? And of course, health is more than medical doctors and so on. We've already said that. But health, the best parameter for health around the world is education. Education is the best vaccination. Educated people will take care that they are healthy and their loved ones, their family, and they care for are healthy. Education is the most important thing in the world. Okay,
but then let me ask you, because the private sector also can do a lot for knowledge transfer. Do you have any laboratories or corporations in, let's say, the global south?
Yeah. So maybe just want to make the point, education, I think we can go so far and say education saves lives, right? I mean, that's just the direct connectivity, because this basic information is crucial. You know, it comes to infectious diseases, vaccination. That is crucial. That's why, you know, in those collaborations I just mentioned before, when you work with local societies, key part of that is education, right? The Trachoma initiative I talked about. There's elements where you educate the medical staff, you know, help nurses, caregivers, how to deal with those issues and diseases. And also the other aspect, working on oncology in sub-Saharan Africa, a key aspect is education, patient awareness, you know, knowledge about how can the healthcare delivery be organized, you know, transporting, refrigerating, all of that, you know, that is a key aspect of the programs we run. There's another aspect, I think, which is important, and that's more, you know, as a company, to leverage your thinking. You know, you need to have ambassadors, right, in your company who learn that, you know, who get exposed. And we have a program which we call a Global Health Fellow Program. Since many years it's in place, so Pfizer employees can apply for that. 3 or 6 month secondments. It's mainly in West Africa or in Asia. And we had a couple of hundred, I think 340 Pfizer employees participating in that programs in, you know, many countries already. And they learn about the issues, you know, they learn about what it really takes and needs, and they become ambassadors in our company. And I think that sort of also closes the loop, right? That you as a company, you really get down to where the needs and the issues are. So there's several aspects around, but yeah, education is crucial and essential.
Okay, I think we can all agree on education is crucial, and the role of media and journalists. You definitely understand that one right away. Are there questions from the audience, perhaps, for any one of our? Yes, okay, we have a microphone right next to you.
Yeah, hello. The question is, apart from education, the research and development things which is carried on by the private or the government pharmaceuticals company, if they come out with a new medicine in a developed country, okay, so the new medicine is protected by the patent rights for full 20 years. Okay, and the situations in developing countries is not that good, and they're not, the poor people are not that educated. So won't you think that they should be having the right to medicine and health in a larger perspective without being educated, and the developed countries owe a responsibility in that context, that the research and development carried on by their companies and the medicines, which is very highly costly in their region as well as in developing countries, even after the patent rights have expired. So what do you think about the uneducated developing countries people with respect to right to health for them?
Okay, so this is an issue. Medicine is very costly, and the costs are high in those developing countries, limiting the access to it. Peter, go ahead.
Yeah, maybe I start. So first point, I mean, there is no doubt, people around the world have the right to have access to medicine. I think that's what we all have to commit on, and everyone has to play a part and a role in that. And it's not an easy question, as we all know, right? Because you have described a situation and the challenges. So it takes steps of everyone to start to contribute to lower the barriers. And I just take the example I mentioned before, pneumococcal diseases where vaccination is important. We have one of the vaccines. So what we've done, and that's a bigger initiative with the Gavi Alliance, we've discounted that medicine significantly down to a lower price as part of a bigger initiative to develop vaccination programs. And I think that's just, I mean, you can always argue, could it be lower or not, but we've gone a significant step there. The other aspect is, price of a medicine is one aspect of it, but to have a functional vaccination program, it takes even much more. And you take all the questions of access to the medicine, the transport, the education of staff, you come to a much bigger bucket of cost investment. So what I want to say with that, we have a duty and an obligation, which I believe we fulfill, but it needs the joint effort with others, to create the environment and the integrated healthcare system that those medicines really can get to those patients. So it takes a multidimensional approach to solve it.
So.
Just, I think you're fully correct. Access to medicines is essential. The new Director General of WHO, Dr. Tedros, is coming from Africa. He knows the situation in countries who are in need. And of course, there are several initiatives to really give more money, not only to WHO, but to organizations like Gavi, like Global Fund and others who do help in these countries. But again, you don't want to depend on help from outside. All the countries have to be made, given the opportunity to develop in a way that they don't need that help for long term, but can do what they need to do within their country. So help yourself is, I think, more important, as immediate help, access to medicines and others.
Okay. We have time for maybe one more question if there's one out there. Okay, yeah. Maybe also tell us where you're from, too. I'm sorry, we missed where you are from, just so we know. India. Okay, thank you.
Hello, thank you for the discussion about healthcare. I'm originally from Greece, but I'm based in Sweden doing my master's degree there. And I miss a word in your whole discussion here, which is prevention. And one aspect of healthcare is access to medication. And someone could argue that all the money that the pharmaceutical companies spend can actually increase the market for them in the end, because these people are educated, but also they get the same medicine to treat their own diseases. So what have you done about prevention or about cure of all these diseases and all these conditions that you deal with? Because most of the pharmaceutical companies, at least in my mind, at least, they spend lots of money from their budget only for access and create awareness, but not that much on prevention, because this will not bring.
Okay, so the question is about prevention, investment in prevention, which also ties into education. But maybe briefly.
Thank you very much for your question. This is really coming from the bottom of my heart. We are 7 billion people on this earth. Okay, soon 9-10 billion. We will never be able to afford, not even in the richest countries, to cure and have medication and hospitals available for everybody sick. This will be impossible to pay for. Now we spend about, in rich countries, 10 to 15, 17% of the gross national product for health. This will not be in the future possible. So we do need to concentrate on prevention. And, well, that's another story in itself.
Another 30 minutes if we had the time.
Education is not only the best vaccination, but also the best prevention. If you take care of yourself, you know how to keep healthy, you learn how to stay healthy, that's the best prevention. There are many, many diseases you can avoid.
Just want to add, I think you addressed the point rightly. I mean, if we say we're committed to drive global health. There is no doubt that what you say needs to be part of the equation. So very clearly, when we talk about awareness and education, it needs to address topics which not just refer to a medicine, but also cover the question of healthier lives. What can you do to prevent that? That has to be essentially be part of the equation. Could go in some specifics, but just saying vaccination, all of that, well, which is prevention in a way, but that covers much more than just the information on the medicine, but also what else can you do to prevent that you get sick. So absolutely, that needs to be the core part of the work we do.
Okay, I know there are more questions, and we could definitely talk about this issue much, much longer. We were limited to 30 minutes. If you do have other questions you want to address to either Peter or Detlef, they'll be out here for a little bit. And thank you otherwise for all of you for attending. If you pass the message on, the Global Media Forum is a great place to hear some exciting speeches and good topics, and to learn more about what makes us, on the human level, what's so important for us then. Okay, thank you. Thank you.